The bumblebees, as beautiful as they are, they look a little clumsy, but they get up there and they do fly very, very nicely. They're not as bad as the honeybees, however. The honeybees are more aggressive than the bumblebees, and I know it is difficult to make that differentiation when you're running away from them or trying to swat them, but it's just best to just avoid getting stung, and it'd be nice to keep our pets away from them as well. The weaponry that's involved, we're talking about the stinger, and only the females have a stinger, and it's basically a modified ovipositor, and the female will leave that stinger in the victim and then eviscerate and die. Pretty tragic way to go. And then the patient is left having to deal with the venom and the pathophysiologic consequences. And here we have a higher powered image of that stinger. And you could see that it might be a bit of a challenge to pull this thing out just because of the way the barbs are set up. The venom reactions are due to the components in each of these little insects. The honeybee has phospholipase A, hyaluronidase, tissue phosphatase, and a substance called melittin, while the bumblebee shares a couple of these, such as phospholipase A, and then it goes on to have a serine protease. The hyaluronidase allows for the dissemination of the venom. The acid phosphatase being common to both types of bees here. And there aren't any other allergens found in the honeybee. And I'm sorry, there are some extra allergens found in the bumblebee that are not shared in the honeybee. The component actions of bee venom, when we're looking at melittin, it's a protein that hydrolyzes cell membranes and alters cell permeability, causes histamine release. And then there's another substance called peptide 401 that allows for mast cell degranulation. The phospholipase A is a major antigen that can cause hemolysis when some of these reactions become systemic. And then hyaluronidase, of course, allows for the spreading of the venom. So we're going to be talking basically about endothelial leakage, swelling of soft tissues, and a hypersensitivity reaction that occurs from all of these inflammatory mediators that occur from the mast cell degranulation. As far as how this will affect humans compared to dogs, anaphylaxis in people does occur 1 to 3% of the time, whereas anaphylaxis in the dog, no one really has those statistics. But if it's going to occur historically in other species, it will usually occur within 30 minutes of the sting. When we discussed the Africanized killer bees venom, it's similar to the honeybees, but it's the numbers of these bees or the swarm that adds up to sometimes cause the demise of the victim. There is a paper published, sorry for the blurry download, but it was in the Journal of Veterinary Radiology and Ultrasound back in 2005 that described a dog that got swarmed by 100 bees which weren't classified. And the dog went into anaphylactic shock and had the acute respiratory distress syndrome. And with support, oxygen, antibiotics, steroids, and antihistamines, the dog made a remarkable recovery after 8 days. And then there was another publication in JVIM, I'm sorry, in JAVMA back in 1999, where the bee type was not mentioned, but a dog presented with lethargy, hematuria, ataxia, and seizures, and then went on to show full-blown IMHA type of presentation, being Coombs positive and spherocytes positive. Of these two dogs, one went on to live and the other died. Steroids and other supportive measures were used in them.